This morning on BRN Wellness, a surprising source of dementia relief, cannabis. And joining me now to discuss this and a lot more, Dr. Jacobo Mintzer of the Medical University of South Carolina. Dr. Mintzer, great to see you. Thanks for joining us on the program this morning.
My pleasure. Thank you for having me.
Let's talk about dementia. From what I've read, dementia is certainly, and cognitive decline certainly is something that I don't know if we're seeing a rise of it, but it's certainly something that impacts our society. Let's talk about how it's treated first. How do physicians, how do individuals typically treat, or can they treat dementia?
So the answer is yes, dementia can be treated. But let me define some terms that will be of help.
Sure.
The first term is dementia itself. And dementia is a status where you have cognitive intellectual impairment that affects you severely enough so you can not perform your daily life in the way you used to before you have this memory and other cognitive impairments. So that's defined. Now, many people confuse dementia with Alzheimer's disease. Alzheimer's disease is one of the causes that can, at some point, lead to the syndrome of dementia, right? So, but today we know that people may have the lesion of Alzheimer's disease about 20 years before they have the first symptom. And therefore, we're talking about asymptomatic Alzheimer's disease and symptomatic Alzheimer's disease. And symptomatic Alzheimer's disease in its more advanced stages will lead to dementia. Now, the treatment for Alzheimer's disease, it's very wide, and we can talk for a long time if you want me to. But probably some of the things we are going to concentrate is the symptoms of behavior, the neuropsychiatric symptoms of dementia, such as agitation, aggression, apathy, and in some cases depression, problems with sleep, etc. So I'm looking forward to hear the next question. So maybe we can sharpen the focus.
Sure. Let's talk about, so I would imagine that there are drugs that have been developed or are in the process of being developed in an effort to treat this disease, dementia, and some of the cognitive challenges that come as a result of that. But let's talk about cannabis, because that, I think, has been identified in certain studies as being able to handle or treat in some way some of these symptoms of dementia.
Okay, so let me start again with defining terms, okay? Cannabis is a generic term that we use to define people with the plant of marijuana. Each plant of marijuana have over 90 different types of cannabis. Each plant will have a different combination of different cannabis. So therefore, when you use or when you treat somebody with one plant of cannabis, you have no idea what they will get in the next plant, because biology is different and every cannabis, any plant of marijuana will be different. And therefore, in order to understand if it has a medical benefit, we need to use purified cannabis. In other words, we need to use each one of the substances that compose the marijuana plant. And if we use purified, we know how much we're giving to each individual. The two components of the marijuana plant that most people talk about when they think about it, they talk about THC and CBD. And to clarify, THC is the most hallucinogenic part of the plant that deals with more of our most of our brain thinking process. And CBD, which is not an addictive substance, can also deal with the brain with more of the anxiety decreasing properties. So depends on what the problem is, we can use and think about one or the other. And in addition, just to finish for a second, is that the plants also THC and CBD combined have certain properties to include anti-inflammatory properties. Specifically can have anti-inflammatory effects in the brain. All these properties needs to be investigated and has been some preliminary work to talk about in different aspects of Alzheimer's disease. And we can talk more specifically in a minute, if you wish, of what aspects of Alzheimer's disease and which one of the treatments is the most appropriate.
Yeah, let's talk about that because I think we're not advocating, at least I don't think we're advocating for people going out and if they have cognitive decline and smoking marijuana. I think what we're talking about is the underlying agents. So how has it been deployed in terms of the treatments and is it effective?
So the efficacy, we're still learning it, but we now can look at specific components of the marijuana plant. And as I say, THC and CBD that can be made up to FDA standards. And specifically, I happen to be the principal investigator of a study supported by the National Institute on Aging, in which we focus on purified THC in combination to purify CBD for a very specific purpose. And the purpose is to alleviate the agitation and suffering that individuals have during the dying process. So individuals with memory problems, cognitive impairments, with dementia, during the last few days of their life. And the problem with that is that the medication today we use that have very little scientifically obtained evidence, which are morphine, Valium, and haloperidol, usually have and present with severe side effects, which includes pruritus, which is very difficult itching, severe constipation, increasing confusion, and the onset of rigidity and motor problems. So our goal for this peculiar combination at this peculiar dose is to try to alleviate the symptoms of anxiety, despair, and agitation that precede the dying process in many, many individuals.
And how do you administer this, doctor? Is it by mouth? Is it by injection? A combination?
What we're giving is a flavor oil. And the reason that we choose that deliver is because many of the patients that we treat, they are so impaired that have difficulty swallowing. Some of them cannot have feeding tubes, and therefore you can put the oil through the feeding tube. And some of them are not very willing to, because of the agitation, to take medication. So you can put it in a drink or something else, the flavor oil.
In terms of obviously you've done some work in this area or a lot of work in this area, but you've done some preliminary testing. How have the results been? Are you seeing positive results and therefore needing additional testing?
So there have been preliminary work done actually not by our group, but other groups around the country, one at the University of Toronto and another one at Hopkins. And they didn't deal with these peculiar patients, and they didn't use THC or CBD itself, but they did use synthetic versions of THC and CBD combination. And both studies show positive results in small samples in individuals with dementia and agitation, but not the individuals as complex and with so much suffering as the target individuals that we have. But in those studies have shown very promising results, that combination of THC and CBD.
And in terms of next steps, so you've seen some positive results. How do you what's the next steps in terms of testing and furthering your research?
So the bottom line is the following. The marijuana plant and its extracts have the potential to be therapeutic tools. We just need to know how to use them, right? A hammer is a tool. It will generate good furniture or bad furniture depending on the person that actually is the carpenter, right? The same thing are with these tools. And that it's our job now to find the right cannabis combination for the right person at the right time. And the way to do it is through clinical trials. So we establish now, I think, pretty much the methodology to do this research. And now the goal is to build on the results we have and also try to learn more about the properties of these compounds and see where else in the dementia spectrum can be helpful.
Well, I think obviously this will bring relief. You're already showing it's bringing relief to these patients, but imagine the relief it's going to bring to their family. Dr. Mintzer, we're going to have to leave it there. Excellent research. Thanks so much for sharing, and we look forward to having you back on the program again very soon.
Thank you for the opportunity.
And don't forget to subscribe to our daily newsletter, The Morning Pulse, for all the news in one place. Details, of course, at our website. And we're back again tomorrow for another edition of BRN. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.